Many people around the world suffer from back pain. It's one of the most common reasons people search for medical advice online or on YouTube. If you have back pain, then you know how frustrating and debilitating it can be. Now, there are many causes of back pain, so treatment depends on what's causing it. Unfortunately, this is where many people go wrong. They just pop in a painkiller tablet like paracetamol or ibuprofen, and they hope their back pain will go away. But the truth is, these tablets only relieve symptoms. They don't actually cure the underlying problem. And in fact, some of these painkillers can cause serious side effects if used for a long time. So in this video, I'm going to tell you about the proper long-term treatment for your back pain. I'm a doctor. I'm a doctor. In this video, we'll cover 5 important things about back pain treatment. No. 1. The common causes of back pain. Number 2. The medicines that can help to relieve back pain. No. 3. When not to take medicines for back pain. No. 4. The best long-term treatment for back pain. And number 5. When to see a doctor urgently if you have back pain. The first thing you need to know is that back pain can be caused by many different things. So it is important to figure out what is causing it, because the treatment will depend on the cause. Some common causes are wrong posture while sitting or sleeping. This is one of the most common causes of back pain. Lifting something heavy, sudden muscle strain or muscle spasm. You may have a slipped or herniated disc. Your bones may be weak due to osteoporosis, or you may have arthritis, which is a problem with the joints. Now, the treatment will depend on what is causing your back pain. In most cases, painkiller tablets can give you some relief. However, you must never take these tablets for a long time without speaking to your doctor first. So let's discuss the most common painkiller tablets used for back pain. No, paracetamol. This is a well-known painkiller. You may know it as Panadol or Paracetamol is suitable for mild back pain. The usual dose is 1 or 2 tablets every 4 to 6 hours. Be careful though, because taking too much paracetamol can damage your liver, so do not take more than the recommended dose. Number dose. Ibuprofen or These are called non-steroidal anti-inflammatory drugs, or NSAIDs. They help relieve both pain and inflammation. Inflammation is your body's natural response to injury. It's good in the short term because it helps repair damaged tissue, but sometimes the inflammation can stay around too long, and it keeps irritating the nerves. So NSAIDs like ibuprofen or naproxen can help reduce the inflammation. These are usually safe for short-term use. However, you must be careful because they can cause stomach ulcers and bleeding. If you have ever had an ulcer or bleeding in your stomach before, then you should avoid these tablets. Also, if you have kidney or liver disease, then speak to your doctor before taking them. No. 3. Diclofenac or if paracetamol and NSAIDs do not relieve your back pain, then your doctor might prescribe stronger painkillers. One of these is Sometimes it comes as a gel that you rub into your back, or it can come as a tablet. Another option is aceclofenac. Again, these are stronger painkillers, so they should only be taken for a short time. Number 4. Muscle relaxants. If your muscles are stiff or in spasm, then your doctor might prescribe muscle relaxants. Some examples are thiacolchicoside or tizanidine. They do help to relax the muscles, but unfortunately, they also cause drowsiness. So you should not drive if you take these. No. 5. Vitamin D and calcium. If your bones are weak due to osteoporosis, then your doctor might prescribe vitamin D and calcium supplements. But please remember, these medicines are only good for short-term relief of back pain. To get rid of back pain for a long time, you need to do other things. So let's discuss when you should not take medicines for back pain. You should never take aspirin for back pain. Even though aspirin is a well-known painkiller, it's not good for treating back pain. This is because it does not do anything to fix the underlying problem, and it can cause serious side effects, including stomach ulcers and bleeding. Now, the best long-term treatment for back pain is to address the underlying cause. So, let's look at the main causes and how to treat them. If your back pain is caused by wrong posture while sitting or sleeping, then you need to learn the proper posture. If your back pain is caused by lifting something heavy, You need to learn how to lift heavy objects safely. And if it's due to muscle strain or muscle spasm, then you need to do back stretching and strengthening exercises. If you have a slipped or herniated disc, then you need to rest until it heals. And if your bones are weak due to osteoporosis, then you need to do weight-bearing exercises and eat a balanced diet rich in calcium and vitamin D. And finally, if you have arthritis, then your doctor might prescribe anti-inflammatory medicines such as methotrexate or biologics. In all cases, doing regular back exercises is very important. But why do we need to do exercises if we have back pain? Well, our back muscles are very important for posture. They hold our body upright. They also protect the bones and discs in our spine. But when we have back pain, we tend to move less. We become less active. This makes our muscles weaker. So we need to strengthen our back muscles and keep them moving. Otherwise, the muscles will get weaker and the problem will get worse. So what kind of exercises are best for back pain? Gentle aerobic exercises are a good start. These include walking, swimming, or cycling. These help improve blood circulation in the spine. They bring oxygen and nutrients to the discs in our spine. This helps to heal the damaged tissue. Aerobic exercise also helps to relieve stress. Stress can make muscle tension worse, so doing aerobic exercises every day is a good idea. But remember to start slowly and gradually increase the duration and intensity. Next, gentle back strengthening exercises are also important. One example is the bridge exercise. Another one is pelvic tilt. These exercises help strengthen the muscles in your buttocks and lower back. They support the discs in your spine. These exercises can help prevent future injuries and re-injury. You should aim to do these exercises at least 3 times a week. Now let's talk about when you should see a doctor urgently if you have back pain. Please go to the nearest emergency room if you have any of these. No. 1. If your back pain lasts longer than 6 weeks, especially if you're not getting any better. No. 2. If you have numbness or weakness in your legs. This could be a sign of a slipped disc or a nerve problem. No. 3. If you have lost bladder or bowel control, this is a medical emergency. And finally, if you have sudden severe pain in your back, especially if it happens after an injury, this could be a sign of a fracture or broken bone in your spine. Lastly, if you'd like me to show you some easy daily exercises with pictures 3D style that you can follow at home for back pain relief, then leave a comment below. Let me know. I will post a video with simple exercises that you can do at home. Thank you very much for watching this video. I hope you found it useful. Please do not forget to subscribe for more health videos and share this video with your friends if you think it will help them. Thank you very much and see you next time.